Children embody the hopes of our future, yet a large number of them experience some form of emotional, physical, or sexual abuse. Child health professionals are alarmed. They want communities, law enforcement, and the Department of Social Development to work together in creating an environment free of child abuse, violence, neglect, and exploitation.
Our staff are very skilled, but it's only about the issue of the numbers because we don't have money to appoint as many, and the social ills are there. But that's why I was saying that it needs the whole of society. When we identify, I'm saying we, not only help, we identify families at risk, especially their children that are there, it means that social workers and other sectors must go and make sure that a child is protected.
The Red Cross War Memorial Hospital offers specialist pediatric care and gets child referrals from across African continent. But it says that it lacks funds to hire more adequately trained childcare professionals.
Child abuse is actually a very ugly social ill and has many faces, some of which are very obvious. So, for example, a child who has been physically abused is very easy to identify. They come in with bruises or broken bones, damaged organs. Those are easy to find, but it's how you relate the findings to what's happened, how it happened, and that requires skill. And so we rely very much on our social work department. So it's actually a team that deal with child protection rather than calling it child abuse. It's about child protection because it's everybody's business.
The hospital has raised 50% of the 8 million rand needed for a specialized child protection room.
Injury, and so lots of red flags were coming up. And then when we built the emergency center for the hospital, the question came up, let's put in a child protection room within the emergency center. So if you think a children's hospital child protection room, it's something that shouldn't actually exist, but the need is there. So what the CEO has said of the Red Cross Children's Hospital, Dr. Anita Pabu, is that child protection has become such a concern that is one of the priorities for the hospital. And that's why the Trust is supporting what we are calling a child protection project, which is strengthening child protection care at the hospital.
Meanwhile, Minister Mbombo has also responded to healthcare workers at the Brackengate COVID-19 facility, whose contracts expired on Thursday. She says that even though the sector is understaffed, not all staff will be retained because of budgetary constraints. Athule Joga, SABC News, Cape Town.